Evidence-based practice, or EBP, is defined as the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences, according to the APA Presidential Task Force 2006, as cited in Corey et al. 2024 on page 446. According to the textbook on page 446, the overarching goal of EBP is to enhance the effectiveness of client services and improve public health. Mental health professionals are urged to adopt a proactive stance to ensure this goal remains a driving force in their work. 3 key advantages of EBP in the counseling field include improved treatment outcomes, enhanced accountability and standardization, and increased access to care through insurance reimbursement. First, EBP promotes the use of interventions that have been rigorously evaluated through scientific research, known as empirically supported treatments, or ESTs. These treatments are specifically designed to address particular disorders, thereby enhancing both the quality and reliability of mental health care. For example, cognitive behavioral therapies have demonstrated strong efficacy in treating a wide range of psychological conditions, including depression, social phobias, and eating disorders, according to Holland and Beck 2013, as cited in Corey et al. 2024, page 446. ESTs support the primary aim of EBP in increasing the effectiveness of services and contributing to improved public health outcomes. Second, evidence-based practice provides a framework for accountability, enabling counselors to demonstrate the effectiveness of their interventions. This is especially important in today's healthcare systems, where practitioners are often required to justify their treatment approaches to both clients and insurance providers. According to Norcross and Lambert 2019, mental health professionals are challenged by the mandate to demonstrate the efficiency and efficacy of their services they provide, as cited in Corey et al. 2024, page 446. Without using evidence-based interventions, counselors may fall short in helping clients improve, underscoring the need for professionals to be well informed about which practices are most effective in specific contexts. A third advantage of EBP is its alignment with insurance requirements. Insurance providers and managed care organizations are more likely to reimburse treatments that are evidence-based, thereby increasing clients' access to counseling services. This also encourages practitioners to adopt interventions that have demonstrated effectiveness, according to Pope and Wedding 2014, as cited in Corey et al. 2024, page 446. Despite its advantages, evidence-based practice is not without limitations. One major criticism is its emphasis on structured treatment protocols, which may overlook the complexity and individuality of clients' lived experiences. Lazarus and Rago 2013 argue that treatment manuals often fail to take into account the nuances of the client-therapist relationship, posing the question, what should therapists do when clients do not respond to manualized treatments or present with a problem for which no treatment manual exists, as cited in Corey et al. 2024, page 446. A second limitation concerns the central role of the therapeutic alliance in successful outcomes. Research consistently shows that the quality of the relationship between client and therapist is a major predictor of treatment success. Norcross and Lambert 2019 emphasized that the therapist's personal attributes in the therapeutic relationship contribute at least as much as the particular treatment method used, as cited in Corey et al. 2024, page 448. Evidence-based practice may undervalue these relational and interpersonal factors by focusing too heavily on technique and protocol. A third concern is the close association between evidence-based practice and DSM-5 diagnoses, which raises ethical issues. Therapists may feel compelled to assign a diagnosis simply to obtain insurance reimbursement, even when the diagnosis does not accurately reflect the client's condition. This practice is considered both unethical and potentially fraudulent, according to Braun and Cox 2005, as cited in Corey et al. 2024, page 437. Additionally, diagnosing for insurance purposes can contribute to client stigmatization and the oversimplification of complex emotional experiences. Nonetheless, managed care organizations continue to favor evidence-based practice due to its emphasis on cost-effectiveness and structured delivery. ESTs are often brief, standardized, and manualized, aligning well with the priorities of managed care systems. Edwards et al. 2004 note that treatment manuals identify what is to be done in each therapy session and how many sessions will be required, as cited in Corey et al. 2024, page 446, which helps providers manage both treatment planning and cost. Bolin and Hall 2007 further argue that providers are often evaluated based on their ability to implement focused, efficient interventions, as cited in Corey et al. 2024, page 446. Regarding ethical issues associated with evidence-based practice, multiple factors play a role. As previously mentioned, one ethical issue with EBP is the risk of providing diagnoses solely for the purpose of insurance reimbursement. According to the textbook on page 446, Pope and Wedding 2014 cautioned that business and financial considerations can drive treatment decisions, creating a potentially unethical focus on what insurers will approve rather than what is best for the client. Another ethical concern arises from the cultural limitations of EBP. Many studies on which evidence-based practice is based may not adequately represent diverse populations. The APA Presidential Task Force 2006, as cited in the textbook, stresses the importance of considering patient characteristics, culture, and preferences when applying research to clinical practice. Ignoring these factors can lead to mismatched or ineffective interventions. Lastly, human behavior is multifaceted, and not all clients fit neatly into diagnostic criteria. Standardized evidence-based practice models may inadequately address existential concerns or the deeper meaning-making processes that are often central to therapy. Lazarus and Rego 2013 argue that an over-reliance on symptom-focused interventions can hinder holistic healing, as cited in Corey et al. 2024, page 446. In conclusion, evidence-based practice has significantly advanced the field of mental health by promoting more effective, accountable, and accessible care. Its structure and alignment with managed care systems make it an appealing model for service delivery. However, the limitations and ethical concerns associated with EBP, such as cultural insensitivity, diagnostic misuse, and the undervaluing of the therapeutic relationship, must be carefully considered. As Norcross, Bootler, and Levant 2006 assert, mental health professionals must engage in informed dialogue and respectful debate to ensure that the application of evidence-based practice remains both ethical and client-centered, as cited in Corey et al. 2024, page 446.